There's a giant banner over my forehead. That looks fantastic. Hello, welcome. There's a giant IOCDF on my forehead, which looks great. Hold on. Wait. I can lower the chair.
There we go.
Much better.
My keyboard is like this. This is super weird. I can't do that. Okay, so what's up, everybody? Welcome into Saturday, 2 p.m. This is the State of the International OCD Foundation Town Hall. Thank you, Fran, for removing the now I'm going to sit back up. As always, we like to give it a couple minutes for people to get in, get settled. This is no different. Wow, we have comments. Say hello. Let us know where you're at. Hey, Grace, it's good to see you. And I saw your Facebook message or email. I will respond. Hello, Thomas. Good to see you. Nice jacket. Thank you. I appreciate it. I learned how to sew it over the last 2 months, so I made it myself. So definitely say hello. We will get started in exactly 1 minute. Hope everybody is having a good start to their weekend and had a good week. Hi, Jason Spielman. Nice jacket. Thank you. Nobody's seen me in a jacket. I don't think I've ever worn one. I don't want to blow my street cred. Hello from Holland. Hello in Holland.
Wow.
Hi, Debbie in Natick, Mass. Not too far from the foundation. We've got Kimberly in Dallas. And I want to say his name, India. But I Mr. Rajan, I can say your last name, your first. I'd be curious how to say third. Anyway, hi, Carol in Minnesota, Nancy in Virginia. We're coming up on 20 seconds. We'll get started. Grab a seat, get comfortable. There is sushi on the bar. Hey, Crystal, how are you? Hey, Katie, looking fancy. Thank you. I'm going to get Mr. Rajan's first name correctly, and then I want him to let me know if I said it correctly. Thurignanasambatham. Thurignanasambatham. Is that close? Thurignanasam. Yeah,
no.
Thurignanasambatham. It is.
No.
He's going to weigh in and tell me. Mr. Rajan, let me know if that was solid. Shala, hi, Shala. We've got Brian from British Columbia. We've got Ulrika from Sweden. We are internationally represented because we are the International OCD Foundation. I will wait for Mr. Rajan to weigh in. In the meantime, let's get started. We are 30 seconds over. Welcome to the State of the International OCD Foundation Town Hall. These are updates on all things international. Oh, Mr. Rajan said perfect. So nailed it.
Lies.
He's not lying. We are like this. We'll Facebook later. These are all things updates on the International OCD Foundation. My name is Ethan. I am the National Ambassador for the International OCD Foundation, which simply means I have OCD and represent the foundation, all things advocacy and media. Just some quick housekeeping work. This town hall is intended to serve as educational content and is not intended to replace therapy, though we won't be doing a lot of that. For treatment-related questions, please be sure to work with your local provider or contact a local clinician. The International OCD Foundation is not a crisis hotline and should not be used if you are in distress or feel unsafe. If you are in a crisis or ever feeling suicidal or unsafe, please go to your local emergency room, call 911, or call the suicide hotline, prevention hotline at the number below. As always, we encourage you to be respectful and kind. This is a public forum, but we always try to create a safe space. So again, thank you for joining us for our State of the Union International OCD Foundation Town Hall. We will be addressing any and all questions that you may have. As always, we will have a Q&A toward the end, so feel free to have questions ready. If you found that we have not answered your question, please let us know, and we will answer to the best of our ability. Hi, Joanne Winston. So first of all, let me introduce our amazing panel and people who work tirelessly for the OCD community, both at the IOCDF and at Elizabeth's Peace of Mind Foundation too. So to my side, because I never know if it's left or right on camera, but we have Dr. Jeff Szymanski. He's a clinical psychologist who has served as the executive director of the International OCD Foundation for the past decade. Previously, he was the director of psychological services at the OCD Institute at McLean Hospital. As a clinical instructor in psychology at Harvard Medical School, he supervises pre-doctoral psychology interns through McLean Hospital's internship program. He has given over 100 professional presentations and trainings, and he has appeared in over 100 media stories about OCD and related disorders. He is co-founder and past president of the ACDBS. What does that stand for, Jeff?
The Association for Contextual and Behavioral Sciences.
At the New England chapter and the author of The Perfectionist Handbook. Is there a typo in that book?
Oh my God, tons.
I love that. It's The Perfectionist Handbook. Okay. Just below me is dear friend and amazing advocate, Dr. Elizabeth McIngvale. She is the director of the newly coined McLean OCD Institute at Houston, where she maintains an active clinical research and leadership role. She's the founder of the Peace of Mind Foundation, a nonprofit foundation dedicated to OCD. Dr. McIngvale operates OCDchallenge.org, a free self-help website for OCD, which is live in 6 languages and serves nearly 4,000 individuals. She was the first ever national spokesperson for the International Obsessive Compulsive Foundation and now serves on their board of directors. Dr. McIngvale engages in advocacy, clinical work, research, and teaching related to OCD and anxiety disorders. She is dedicated to giving a voice to the voiceless and is grateful for a career which allows her to improve the lives of those living with mental illness every day. And she definitely lives that life. So thank you, Elizabeth, for being here. Last but certainly not least, we have Susan Boaz. She's the mom of a fabulous 18-year-old, which I can attest to. She is pretty fabulous, and an advocate for kids with PANDAS. Because there's we throw out a lot of acronyms. PANDAS stands for Pediatric Autoimmune Neuropsychology Disorders Associated with Streptococcal Infections. I Googled it. It's true. Which is basically early onset of really symptomatic severe OCD in young children. And it's pretty nasty. So thank you for the work you do. And folks of all ages with OCD. She is fascinated by immunology and psychology and works to demystify ERP for kids because it's such an effective therapy. She is also the president of the International OCD Foundation Board of Directors and has been on the board for 10 years. In her spare time, she is an entrepreneur and owns 2 small businesses. She loves to laugh and has 3 dogs. What are your dogs' names, Susan?
Bella, Emmy, and Oliver.
Bella,
Oliver is crazy, so we have a lot of fun. He's alive.
Okay, cool, awesome. Oliver's the Ethan of the dogs. I like it. So thank you, Jeff, Elizabeth, and Susan for being here. I'm just gonna give you just a quick chance to drop a little intro before we jump into business. Jeff, why don't you give us a hello and initial thoughts?
Yeah, so I'm just going to jump right into the conference. Might as well. That's what everyone's asking about. So here's the good news about the conference for this year. If you were accepted to speak at the conference, your acceptance has been moved to 2021. The conference, we were debating how we were going to talk about this today. The conference as we know it for this year is going to be modified. We are going to shift to a virtual conference for this year. And we are still in a contract with the hotel. And so we still might be able to do an in-person conference. Maybe it'll be locally, maybe it'll be for people who can fly in, that still want to fly in. We still don't know, but we still do have a contract. They're allowing us to modify the contract. But the annual OCD conference is going to move virtual this year, and we're going to have another event, hopefully in person in Seattle. And then again, like I said, everyone who got an acceptance for 2020 will see you in 2021. And then we're going to be busily planning the virtual conference that we'll still host in late July, probably the same dates. So I know we're talking about that's what was on everyone's mind. So I just thought I'd come out the gate and talk about that. And we cycle back around. I'll just let you guys know what it's been like at the IOCDF for the last 2 months as we've all worked remote since mid-March and actually working about 3 times more than we typically do. But so, Liz.
Yes.
What do you think?
Think about
just the conference or just your opening thoughts? What's foremost on your mind?
I think really the point of today is for us to just kind of talk a little bit about where the foundation is, what we're doing, and how we're forging forward in this uncertain time. And I think I want to take a second to say thank you to the leadership that you see amongst Jeff and Susan, and the leadership that's really taken place behind the scenes from the foundation. If you guys have been participating and actively involved, you've seen these town halls, you've seen these events, and you know that, oh my gosh, like they're working 24/7. And, you know, I think it's really important and critical that we just come out and address that and talk about it and recognize it. I also want to say a special thank you to Ethan during this time, because I think those of you that have been following the foundation, and many of you have, you've seen the amount of work he's done. And Ethan, I know for you, you'll say it was my pleasure and you loved it. And I would say the same thing, but I also want us to really recognize how much work these sort of events are, and the preparation after, and the communication after, and the fact that you're doing them not on occasion, but multiple times a week is incredible. And I just want to start by saying thank you all for attending, but I also want to start by really saying thank you to the foundation for the way we've supported the community during this time. I think it's been really incredible for us to see what we do and how we serve people shift overnight, and all hands on deck to make sure we're providing resources that people need when they need them. And it's been remarkable to watch. So I'm just grateful to be a part of the foundation. I'm grateful to be here, and I'm grateful for us to think through how we'll continue to serve people in the most effective and safe way.
Thank you, Liz. Absolutely. Susan.
Yeah, I was just sitting here thinking, Liz, that's exactly right. From the minute all this started, and the foundation is based in Boston, so we had a pretty fast and early shutdown of our offices. And our staff moved to remote, and immediately started brainstorming, what are we going to do now? How do we serve our community right this very second? And it's been really exciting to watch that change to having so many events happening virtually and seeing the reception that we've gotten from the community. So I really echo on what Ethan's done. I'm so impressed by it. I pop into every single one I possibly could get to, and they're just so great. And it's all of the speakers, the doctors and the individuals from across the nation that have come together and that are willing to speak on Saturdays and all during the week. That's been incredibly impressive to me. And then just Jeff and all the staff at the IOCDF has just been so cheerful and positive and really engaged in trying to figure out how to replan things, how to open up to services. And I'm just deeply grateful for that. I think what's really on my mind right now is folks that are at home who have, for example, a child that's just starting to show symptoms, and they're in their home and they're not sure where to go next. They're not sure how to access care. And so that life doesn't stop because we're all at home for a period of time. Things still happen. And so that's really what's on my mind, is how do they find resources and make sure that they get that kid the help that they need right when they need it. And for adults as well. But I really think a lot about that onset, that a parent's just coming to a realization that something is really wrong. And they may be having that realization because they're homeschooling and they're seeing their child in a different light, and they're realizing what some of the challenges are. And so that's definitely on my mind right now.
Absolutely. Thank you, Susan. I know it is all. And thank you all for your kind words. I really, really appreciate it. Sincerely. I'm just quickly, before we move on to some other topics, I'm looking at some of the questions, continued questions about the conference and the virtual conference as well. And I think, what we're hitting at is that, the conference as we know it, that we're familiar with, will be modified and different this year. We will be moving it virtually. And then I know Thomas had a question about what we would be doing in Seattle. And the question is, we're still waiting on information about if and what we can do locally. But the conference as we know it is going to move virtually. And if we're able to do something locally in Seattle, we will try. Then I saw some questions about how do we do the virtual. So for anybody that's watching, I can tell you, no, you have not missed it. You are not late to it. You have not missed tickets. We're literally in the process of incubating the virtual conference, what the schedule will look like, how you can attend, all of that stuff. You will be notified via all social media channels, email blasts, and all that stuff. So all I can say is, with love, be patient. We will get this rolling and create as much content and give you as much of a personal and educational experience and intimate experience as we can virtually. I know that we're already working, the IOCDF is already working very tirelessly to build out programming. I can give you some insight. I don't know whether I'm allowed to, but I can give you some insight that we're talking about, four blocks a day of with multiple tracks. So something like, 16 to 24 panels a day with the same tracks that we have at the regular conference. more or less. I'm gauging off Jeff.
Mhm.
Anyway, more or less, but we're looking at some evening activities as well, some fun things to do. And so we're going to do our best to give you, as much of the physical conference as we can. And then as it gets closer to that time in late July, we'll look at options in Seattle. Is that fair to say, Jeff?
Oh, yeah.
Okay. Go ahead.
I think that one of the questions that we have that some parents might have is about the kids. So we are actually meeting with the conference planning committee a number of times coming up very soon to figure out what kinds of activities we're going to have for kids and parents. So that piece is really, we'll probably have another one of these in a month or so and be able to tell you a lot more about what that will look like. For older kids, it will look very similar to what we're doing for the adults because they can do this information on Zoom. And for younger kids, we're still working on how we're going to present those activities virtually.
Absolutely. I do want to address, I don't want to veer too off schedule, but I'm always gauging questions and want to incorporate. And this is a great question, and it's something that we take very seriously, so I kind of want to throw it out there. Actually, Fran, if you want to put it up, that's fine. SC asks, she's on YouTube, or he, I think all these webinars have been excellent, but I do feel after watching most of these that the IOCDF has a lack of diversity. And this is something, go ahead, Jeff.
Monica Williams. We're looking for a faculty member for the intrusive thoughts.
Oh,
that reminded me. Yeah, no, we're always working on diversity. Monica was the inaugural co-chair of our diversity council, still is active on that council. There are some other people that we will be reaching out to for webinars. I will say it's we're doing 3 things at once because when this first started, we were still planning on our events as planned. And then we were also planning a plan B about what we were going to shift to. On what we're going to do kind of instead of. And then we've been doing about 4 town hall webinars a week, and they are literally on the fly. Ethan, me, and Jess are planning them like 3 days in advance. And so we're just really pulling people from the ether, and everyone has really stepped up and been great. And I think it's a great reminder to keep mixing things up and rotating different people in. But it is a priority at the organization to increase diversity across the board, not just in webinars, but in the conference, the board, the staff, et cetera.
But it's a fair call out, I think.
Oh, yeah, 100%.
I think finding diversity in the mental health community is a challenge for a lot of organizations. Yep. And it's one I feel very strongly about because I think you can only have access to care when you have a strong diversity at a lot of different levels. So it's a completely fair call out. It's something that we're very open to talking about and hearing more ideas about. Mm-hmm. So I appreciate your raising it. And I think it's one of the challenges that we're going to continue to face in the next couple of years, but we're very open to ideas.
Mm-hmm. Yeah, and that's why I wanted to address it. I didn't want people to think we were ignoring it. It is very important. We have a diversity council. We work very hard. And the fact is, at least from a consumer side, that unfortunately, other races, Black, Brown, Asian, and other minorities are extremely stigmatized. They have a double layer of stigma regarding mental illness and their own. I know that I've been really wide open to that stigma in the last 4 or 5 years as I've engaged people of color and hearing about why they don't talk about it, why it's not talked about in their communities and things like that. So we definitely take it very seriously and are always trying to create and foster and nurture a community where people of all races, nationalities, creeds, and all that feel comfortable and can come out in a safe space. So.
I would like to just do a call out to Liz, because I think one of our most effective diversity initiatives in the last couple of years has been a grant we've received from the Peace of Mind Foundation that allows us to do scholarships for therapists of color or therapists who work in rural or underserved populations, or therapists who primarily work with people of color. And we've been able to give out, I think, about 50 scholarships, which I think is really fantastic. And this is for our Behavior Therapy Training Institute. So this is our flagship training to really get someone up to speed in terms of proper diagnosis, understanding the basics of how to deliver exposure response prevention. So again, just the number of people of color, we're going to see more people access treatment. Again, if they're seeing someone who looks like them, we know through research that's a pretty common experience. So again, Liz, I just think that has been an absolutely awesome thing that Peace of Mind has allowed us to do for the last couple of years.
And I think also that there's real excitement in the millennial generation of being very open about mental health care. And so I think we're going to see a real shift in the number of folks of color who are interested in being treatment providers and who are interested in being advocates. And so I think it's important to say that generation is really leading a lot of us, and that we look forward to what else they can sort of teach us about how to tap into that diversity, and also to come forward and really be aware that we're looking for those representatives, and we have scholarships available thanks to Liz and her organization, and hope that you'll come forward to ask us questions about it.
Liz, why is diversity so important for peace of mind?
You know, I think that really everything we do at our foundation has been based and rooted in diversity, whether it's diversity amongst socioeconomic class, ethnicity, language, geographic, where you live, you know, whatever would kind of put you into that population. And really, when I started the foundation, it was really thought after as an effort to bring OCD treatment to people who otherwise might not have access to it. And, you know, we've learned a lot. I mean, I think when we first launched OCD Challenge, we were hoping that it would really be able to impact those who don't usually seek treatment. And what we found over time is that actually the people who use OCD Challenge are people who are already treatment seeking, right? Elder females, typically the highest number of individuals who seek mental health treatment. And so we're always trying to be flexible. We're always trying to learn. And what I'll say is that you're right. I mean, I think there's no reason to skirt or dance around it. Our diversity is an initiative that we have, and it's something we need to improve on all fronts, because the reality is that OCD and mental health affect everybody equally. Mm-hmm. It doesn't only affect certain populations, even though that may be who seeks out treatment first. And there's a lot of initiatives that take place, whether it's, you know, I know we do a ton of work in congregations and trying to increase education, assessment, and understanding of OCD treatment, so that then it can be talked about differently, because the ways people seek treatment is different depending on your culture, your background, your understanding, and the stigma that is there for mental health. So we need to continue to grow. And if you have any specific ideas, please let us know. Because I do think that if at our conference, right, it's improving. It's not where it needs to be, but diversity is certainly improving. And so I'm hopeful that we can take that message to light and do what we can to help improve diversity on our webinars as well.
Yeah, you know, I think when we first started collecting demographic data at our conference a few years ago, we were at 8%. In this last year, we were at 15%. So we're getting there slowly, but we're getting there.
Excellent. So thank you. I wanted to bring that up. I didn't mean to tangent us so far. So we've got details on the conference, which we announced. If you missed the announcement, please go back. It is recorded, and you'll be able to see. We have a lot of other things on the agenda. There are still tons and tons of questions. There's great comments. Everybody is very supportive of future moves based on what we talked about. For those of you that are asking very specific questions about the virtual conference and all that, we don't know.
I can talk some about it if you want.
Oh, well, let's go through the agenda, and then we'll. Just people are talking about ticketing and discounts and things that we probably don't know yet, or maybe we do. But lots and lots of great comments and great support. So thank you guys. And as always, I have to give Nikki a shout out in Dublin, because that is my one thing I have to do during everything. So we can get to questions, load them in. Let's get through the rest of this agenda. So we definitely want to talk, aside from the conference, we want to talk about walk updates in our affiliates. Normally we have the 1 million walks for OCD in June, 1 million steps for OCD in June. What is the latest on those events, Jeff?
Yep. So we have moved the Boston walk to late September. We have had to get a different venue because the venue that we were at was already booked. And so all the affiliates also are moving their walks to the fall, either in September or October. We're letting them pick their dates, because it'll be the same thing. It'll be dependent on their ability to get sites that they want. So be on the lookout for that. We'll update you via email, but again, no walks in June. They'll all be in the fall this year. Yeah. Oh, so what we decided to do instead on June 6th, which was typically when most of the walks happened, is we're working with Ethan and a couple of our, what we're calling our lead ambassadors, Morgan Rondandelli and Jen Coward. And they came up with 1 million moves for OCD. So we're going to do some fun dance, yoga, Simon Says, choreographed free-for-all, something or other. We're going to try and make some final decisions about that in the next week or so.
Excellent, excellent. I know, Jeff, that you had some thoughts you wanted to address, actually in a private chat, about the BTTIs, training institutes, grant programs. Did you want to talk a little bit about that stuff?
Yeah, so we had 2 behavior therapy training institutes that were scheduled in May. They got moved to October, and hopefully we'll be able to do in-person events for 30 people in October. We've been talking about the BTTI going virtually. I think that's going to be super hard to do. So that's still a question mark. What we did do is we had been working on a webinar series all last year, and we were able to roll that out, kind of fast track that. So if you're a professional or a student, you want to go and get some CEUs, we have hour-long webinars online now. We did about a dozen online consultation groups this spring. We're going to wait until the fall to do another round. We're actually going to put another set in the summer. And again, trying to make lemonade out of lemons. What's been fun about these town halls, and we did some education staycations, is we'll probably continue to do those. We had been wanting to do more virtual stuff, and this just kind of pushed us into that. Again, the other silver lining of the conference going virtual is we're now always going to have a virtual component to the conference. Something we've been wanting to do. Now we're experts. We looked at 40 different platforms. The staff have been working really the last 3 weeks or so. We just kind of shifted from the in-person conference and have been working on the virtual conference. So, I think there's a lot of very creative things we've been doing, webinars, and in terms of learning how other people are doing this. We've been watching other organizations. So people are ahead of us. We're going to see what works and doesn't work. So I think the conference, virtual conference at the end of, in the middle of the summer for us, I think is actually going to be really quite strong for that reason.
And do you want to touch briefly on your grant program, and that's still moving forward?
Yeah, so the research grant funding has been already secured. And so we had a number of grants come in. Ethan, you might be able to read some of the specific numbers. I don't have them pulled up, but a very...
Sorry, go ahead, Jeff.
Yeah, so 55 applications came in, which is about typical. That program has always been virtual anyway, so it's been able to move forward. But it was nice that we had the funding kind of already secured for that, so that there was no interruption in that.
Absolutely. So, Liz, I'll throw this to you. We have been working in conjunction with your foundation, Peace of Mind, which is amazing. So Liz has been working double as a board member of the IOCDF, as well as the executive director of her own foundation. So what have we, both you and the IOCDF, been doing and plan to do moving forward in terms of advocacy, continuing to address the COVID-19 crisis and supporting the mental health community?
Yeah, I think that Peace of Mind has been doing a lot of stuff virtually for a while, and it's been an initiative for us that's been really important for many reasons, mainly because our goal when we started was to help as many people as we can access treatment. So we started as a small foundation that used to sponsor and actually pay for treatment for individuals. And we realized that it just didn't go very far, right? We would spend a lot of money and be able to help one person compared to could we make this make a bigger impact. And so that's what really launched us into OCD Challenge and starting to do webinars and talks. And so I think for us, we saw and knew that the potential existed because I've been doing the Facebook Live or different things for a while. And it just was a perfect opportunity for us to say, hey, IOCDF, Peace of Mind, a lot of what we do is the same. How can we do this together and make sure that we're not stepping on each other's toes? It doesn't make sense for both of us to host the same event in the same week, but really Peace of Mind as a strategic partner of IOCDF and hopefully continuing to grow in what we do and merge even closer. It really was us saying, what can we do to help serve? So what webinars and events can we do that would positively impact what the foundation does and vice versa? I've always been a believer that everything we do should be shared, right? Of course, my sister reminds me every day that she's the one that came up with OCD is not an adjective slogan. I'll just put it out there. She wants to know when she's getting, she's like, y'all are all using it. This is so great. You should be so thankful. I'm like, okay, Laura, we are so grateful for you. No, but this is a community. It's about us sharing. It's about content sharing, creating an opportunity for us to improve the lives of people with OCD overall on the biggest platform that we can. And I know at the core of all that we do, that's really what we believe and what we strive for. And so, COVID-19 launched us into a world none of us were ready for. and it's been wonderful. It's worked out. I mean, I think that we've had incredible response. Even as a clinician, none of us expected to take our entire practices virtual overnight, and that we would have to be serving more intense patients in a virtual format and doing things we've never done. But we did it, and we're making it work. It doesn't mean it hasn't been stressful, but it's about working together and serving the community. And so Peace of Mind will continue to do what we do as far as our community work, but now I'm hoping everything we do is going to be more in collaboration and in line with the International OCD Foundation, so that we can, again, be serving each other effectively versus any of us doing the same work twice.
Thank you. Thank you, Liz. Susan, I will turn to you in a half moment. Jeff, do you want to speak a little bit on continuing to work with local groups like the Mental Health Liaison Group and the Health Innovation Alliance, working with legislation to make sure that mental health stays on the forefront of the conversation with COVID-19?
Yeah, I think I've been saying this for probably 4 or 5 years now. I think for a lot of people with OCD, teletherapy might actually be a better option than in an office, right? You're triggered at home. You're triggered in the community. You're not triggered in your therapist's office. So one of the biggest limiting factors pre-COVID was that you couldn't practice across state lines. And so you had to find a provider within the state. Now, something that's cool that NoCD is doing. NoCD started as an app, and now they're developing a virtual component. They hired Patrick McGrath as their clinical and training director. And so he's training a couple people in every state. And again, this was prior to COVID, so that anyone could get teletherapy within their state. Now, we have been arguing, as part of the Mental Health Liaison Group, is a lobbying group of about, I think it's 60 or 80 mental health organizations, including us. And we sign on to letters and so on that encourage Congress to open up teletherapy guidelines and options. I think we're going to see something very different at post-COVID. I think a lot of people will stay virtual, and again, I think it will be better treatment for some. It'll be better access for some. For many, frankly, if you don't live in an urban area, we hear people are driving 30, 60, 90 minutes, 2 hours one way for their therapist. And that's unacceptable. So I think now that everyone is set up virtually, frankly, we just created a page on our website. It used to be you could go in the resource directory and you could click on and see if there's a teletherapy provider in your area, but we just built a whole page. I think we have 60 providers. It's going to turn into virtually everyone, virtually, no pun intended. But we also are beginning to capture support groups that we're meeting in person that have been able to go virtual and online. And so again, I think all those resources will stick around after this. And again, I think that's going to be a huge increase in terms of access to care. But again, that's been a big part of what we've been doing with the Mental Health Liaison Group is, better access to your insurance benefits and really pushing access to teletherapy.
And I just go that as a patient with OCD, I think that I remember when I first was stepping down from intensive treatment, and my mom was doing everything she could in Houston to find an ERP provider who would do home visits, because it's just that's where my OCD was most triggered, and we just couldn't find it. And when we did, it was astronomically expensive. And I think that for us being able to, as clinicians, being able to see, okay, now ERP can work beautifully through teletherapy. We can offer treatment in people's home in their real life environment. And then what Jeff was just mentioning, right? There tends to be these epicenters across the US and globe that are OCD hubs, right? When you think of it, you think of Boston, you think of Houston, you think of Oconomowoc, Wisconsin. You think of these places where there's specialty treatment centers and where we know they exist. And surrounding there, you see some providers who get trained there and slowly work in the community. But what about the people in Laredo, Texas? What about the individuals in El Paso? Or I'm just talking about, again, my state, where there's not any providers, and there's not any providers that they can access in a driving distance. And so I just want to reiterate that teletherapy has broken down those kind of glass ceilings for us. And it's really allowed us to say, wow, we can serve patients that we know need our service in an effective manner. And that's been one of the blessings of COVID-19 for the OCD community. I think that if we're looking at silver linings, to me, that's a silver lining. And as Jeff was mentioning, I hope it propels treatment forever. And I also think that even for the IOCDF, we've realized somebody's from London, somebody's from Norway, somebody's from Ireland, somebody's right. And they're using our platforms and they're connecting with us and they're watching our webinars, and it really makes us value technology and what we can do to serve people with OCD across the globe. So I just want to throw that out there, that as I'm seeing a lot of people say, can I get teletherapy? Can I get ERP treatment? Absolutely. You can get effective ERP treatment through a teletherapy option. I do want to reinforce, or just to say what I always say, you want to be going to an OCD specialist if you have OCD. You want them to be trained in ERP. You want them to be providing what we call evidence-based care, right? That's care that's based and rooted in research and that we know is effective, because lots of other clinicians are doing teletherapy who don't treat OCD. So be careful, and allow people to help you, but hi from Scotland as well. So anyway, that's my pitch. It's been amazing to watch it happen. And I'm excited to see how IOCDF is going to continue to support the virtual community, even when life goes back to in-person.
Yeah, and Fran, can you post the resource page on teletherapy for the COVID, from the COVID resource page?
Yeah, we'll put a link in the comment stream.
And there's the teletherapy providers
as well. Yes. So everybody's asking great questions, which I actually want to get to, because I think this is a really good opportunity for, from a consumer perspective, from an OCD sufferer perspective, to access the IOCDF and ask questions and get some, better understanding as to what everyone is doing and why. So I'm going to work our way through this agenda pretty quickly, and then we'll get to some questions. Before I get to some questions, I actually want to call on Susan a second. We didn't write this down, but you're a mom, you're a business owner, you're the president of the board of the directors of the IOCDF. What's important to you moving forward for the IOCDF? What would you like to see? What is your vision for the next 2 or 3 years? Where do you like to see things go? I know I'm putting you on the spot, but.
No, that's okay. It's actually something we were thinking and talking about a lot lately. The thing that we've always wanted to do, and it really tags into what Liz is saying, is help the greatest number of people. Right now, it still takes a very long time for folks to be diagnosed with OCD. And so they suffer unnecessarily. And what our goal has always been is to decrease that amount of time and to get people effective therapy very quickly in the early years that they're suffering. And the number one issue that I always hear from the moms that I talk with is, where can I take my kid? There's not a provider in my local area. And I've always wanted to see a virtual platform for therapy, because if it's not available in someone's local area, it's worse than nothing to send the child to a provider, for example, who doesn't do ERP therapy, because now you've got a kid who's thinking that therapy doesn't work, and that they may take that with them for the rest of their lives. So I think encouraging teletherapy to be an option that continues, to be training the largest number of therapists. That's been another thing that's been a frustration for us over the years, is how do we train more therapists to be able to do ERP therapy effectively? So I think Liz called it, if you're looking for a silver lining, and I really think this has been an unbelievable silver lining, is that it's pushed us to platforms and to understanding virtual training, virtual conferences, virtual therapy in ways that we've just never understood before. So I'd say in the next 3 to 5 years, if we can increase the number of folks that we're reaching by tenfold, I think that's a realistic goal, actually. I think we could even go bigger than that. And then I think we can reach people in a lot of different countries. I just think that's incredibly exciting, and that's the platform that I want us to be building out over the next 5 years.
Thank you, Susan. I appreciate that. So continuing on our agenda, and I'm going to skip around a little bit. So one of the things we wanted to talk about is the impact of this time on a nonprofit like the OCD Foundation, on the impact of COVID-19. And this ties perfectly into Lily's question at 2:26 p.m., which is the conference the annual major fundraiser for the IOCDF? If so, will a virtual conference impact this? So can you talk a little bit about how the IOCDF is being impacted by COVID-19? How does the shift to virtual impact and so forth? And any of you can take it, Jeff or Susan or Liz.
Okay,
I'm happy to. So I'm happy to start there. Hey, here's the situation. Yes and yes. Yes, our conference is our main fundraiser as the foundation. It is our main event, and registration is really what helps support what we do throughout the year, right? And so there's no doubt that registration is going to look very different when we're thinking about doing a virtual conference and event this year than traditionally. And so we know that we will take a hit when it comes to fundraising unless we can be creative and find a way to use the virtual platform and all the things that we're doing to start raising money. As a consumer, I'll also be candid that, like, for me, when I do things virtually, you just don't think as much about donating. It's not front of mind. Like, it's kind of like, okay, well, this is available, it's accessible. What I want to push all of us is that the content that we are getting access to is content that we would not get access to almost anywhere else in our life, right? We're hearing from leading experts and clinicians, advocates, you name it, with OCD and related disorders for free. And we think about it because it's free for us. But guess what? It's not free for the foundation, right? The foundation and those of us that are behind the scenes doing the work, while I might not get paid, right, from the foundation, they are still hosting it. They're still using their manpower. They still have employees to pay, and they still have to find a way to allow the content to be there and be accessible. And so I want to push us and urge us to donate. We are trying to think creatively about how we could do some sort of a donation event that might make sense virtually. I'm pushing like a share-a-thon or webinar or some type of thing. And so please make sure that you look out for that. And we really appreciate the question, because I think it's a hard, awkward question, candidly, when you're a nonprofit, right? I mean, we never want people to think that, obviously we're not in it for the money. We're a 501c3, but at the same time, we need money to do what we do. And, I think we need to be thinking about how fundraising is going to take a hit and how we are going to not just recover, but continue to thrive and have these resources available.
Thank you.
Yeah, I completely agree with that. I mean, it's a huge concern for this year. I mean, between the walk, which is a huge fundraiser for us in the first half of the year that we're now having to move to the second half of the year, and then the conference, that's a lot of income for the organization. We're a relatively small organization. We're very frugal. But we do big things. I mean, we really are incredibly frugal. And so I actually appreciate your asking the question. I feel like we staged that, but we generally don't bring it up because we're also very sensitive to our community, and that, what's going on for folks that is suffering for OCD is not, that's what's top of mind, and that's what we want to help with. And so fundraising is always something that we do as a slightly softer ask, but we're definitely going to have a challenging year. And, I like to be blunt and say donations are definitely welcome this year.
Absolutely. But I think it's also important not to provide reassurance, but in this case, Jeff, how is the foundation in terms of ability to stay afloat and support the community, frankly?
Yeah, I mean, to be honest, I've just started to kind of think about that. When all this happened, my therapist hat came back on, and I was just like, how are we going to help people? And the conversation with our board and the conversation with the staff was, let's make sure everyone is taken care of, and then let's figure out where we're at. Donations are down a ton. Yeah. Right now, we would be getting registration income for the conference. We would be getting walk donations, not just for the Boston walk, but for all the affiliate walks. None of that's happening. And so we've been very frugal and very conservative, and we have a rainy day fund.
Yeah.
We don't have any plans to lay anyone off, but we don't know what's going to happen to the economy. But if you have a charity, and you have a charity in mind, that's us, and you have the means, yeah, I mean, we need to keep the lights on. Again, I'll say it's interesting when you talk with different people about how they're impacted. So my sister works for Toyota, so she's been laid off for 4 weeks now, and she's like, I'm working on my boat. I don't have anything to do. I'm working 3 jobs. Like, all my staff are working 3 jobs. It's been really intense. But the staff, whether they have been there for 10 years like me, or whether they started last year, like, they are so committed to this community. It is such a lovely community. We are all heartbroken about not being able to get together in Seattle this year. It's really our favorite time of the year. So yeah, I mean, it's interesting doing these town halls because we all find ourselves kind of talking about the same thing and feeling kind of the same kinds of feelings. So yeah.
But I do think it's important to say, Jeff, that the question about reassurance and not giving it, but I think it's important to say that the foundation has a strong donor base. We have a lot of people that support us, and we have a lot of folks that we can reach out to if we have challenges. So we're not going anywhere. There's no concern about that this year. We are here. We are solid. We will be here at the conference next year, and we do need support from folks. So it's both of those.
Thanks, Susan. Yeah, that's what I was asking.
Anything.
Love you, Jeff.
I'm going to reassure you. That's it.
No, I don't need reassurance. Still some great questions being asked. We will definitely get to them. And as I always encourage, like, you guys do such an amazing job of advocating for yourselves, other people answering other questions. Amanda, by the way, I see all your comments about UK. She sent me a beautiful email. Oh no, that was the woman, Liz, who left the beautiful comment on the YouTube video for the adjective. That I actually shared your comment, Amanda. It was really lovely. And so thank you for all the kind words. And actually, we can continue to email and talk. But please take a second, read through. Everybody's answering each other's questions. And I always love to see the insight everyone has.
Here's my little pitch. And Amanda, I have to tell you that Ethan and I share messages to each other. We've both been, as you guys know, doing these events, hosting events almost once or twice a week, and have all these other things going on in our life. So we get pretty overwhelmed, but we kind of will send a little message just of why we do what we do. And your comment was one of them. And it really, those sort of reasons for us make our exhaustion, our kind of all those things, it wipes it away immediately and reminds us of why we do the work that we do. So thank you. Here's my final pitch, 2 things. One, this is a perfect opportunity for those of us who maybe aren't in the capacity or have the ability to fundraise or donate, to educate and to bring awareness and to get people connected with this community. Just because you can't donate $1,000 or $100 doesn't mean you can't talk about or educate people on the work that the foundation does and get them connected. Because the more connections and the bigger our community is, the more people we're helping and serving, and that meets our mission. For those of you who do have an opportunity to donate or to fundraise, right? Remember, you can do Facebook fundraisers, you can do internal fundraisers, you could do a virtual little talk or walk or whatever it might be. Be creative. And I would urge everybody to be creative and think about it. Even little things like on Instagram now, you can add the International OCD Foundation as a donate now button that when you do a little post, people could click that. So let's all work together and be creative. This isn't me saying we're in a panic, we need money, but it is me saying, like, as a member of the community and as somebody who is a person with OCD who benefits greatly from this foundation, I am going to do what I can to help keep the foundation afloat. And we can all do it in different ways.
Thank you, Liz. Absolutely.
Can I interrupt? The fundraisers that you do on Facebook. Okay, I lost a tree in my house, by the way, and so sorry for the light. It's been trying to figure out where the light is in my house now. It fell on my house during a storm last week, which was exciting. But the birthday fundraisers that people do on Facebook is actually a really significant source of income for us. And we're so deeply appreciative. So those of you that have birthdays coming up in the next few months and you're trying to figure out how to celebrate and you can't have a party at your house and people are driving by, actually ask them to do that birthday fundraiser for us. We really, really appreciate that.
Absolutely. Excuse me. So thank you, Liz, and thank you, Susan. And the light looks lovely on you, honestly. Yeah, we didn't need that tree. It was so overrated. So I'm glad we're able. We'll get to a lot of these questions, but you guys are leaving great comments. So thank you. Just a couple other things. And I have an announcement for the end of the town hall. I have an announcement that is personal to me and that you will want to stick around for. I meant to say that at the beginning. So definitely stick around at the end for an announcement that will hopefully make everyone a little brighter today. If you're not, just some other quick points, and then I think we can get to questions. So feel free to load your questions into the comment box, and we will answer to the best of our ability. But one thing I will say that's been very exciting is to watch the IOCDF really launch into action in a variety of ways, not only moving to a virtual platform and creating virtual town halls to support and all this, but the last thing I want to address, and I'll kind of take the lead on this, is we've been very vigilant as a foundation to address misuse of OCD in the community, in the media, and in the public. And what we've seen is a shift in stigma from I'm so OCD to needing OCD and using OCD as a functionality and a tool to combat COVID-19. We've had a lot of conversations around this, and we really wanted to jump as an organization very quickly on this and discuss and powwow, which I have to give out shout out to our dear friend Charlotte Nicely, who has spent countless hours with us having these conversations at how best to address these media outlets and these organizations that are, frankly, I know it's very quick to get emotional and get upset, but are frankly just uneducated as to what OCD is and how it affects the community. So what we're seeing now is really just a continuation of the stigma that we've had as it's informed by COVID-19. So what we've done, a few things: we've written tweets, we've written articles, we've written blog articles. Other people in the community, like Patrick McGrath and John Hirschfield, have stepped up and written really amazing blog articles as well. Shout out to Allegra for her article in Anxiety Today. But if you have been online recently, you have seen our Not an Adjective campaign, which we are very thankful to Liz's sister Laura for the name. I don't mess with Laura. She scares me. So I love you, Laura. You're beautiful. I use Liz to just be around you. But if you have been on, you have seen the videos. It was very important for the foundation to address, again, the misuse of OCD, and that it is not an adjective and that is not a tool, and compulsions are not something that we want, that psychiatric disorders are not an answer to anything. And I just wanted to give a little insight as to why we approached this way. We always want to approach advocacy on education from a place of compassion and love, because we know that most people are not trying to be malicious. The majority of people just don't understand, or just don't know, or they're just not educated. So in any way that we feel we can educate the public and the media that does not have insight into OCD in a way that will be effective and they will listen is really our goal and how we approach this. So we really wanted to take a proactive, not reactive approach with this video and basically say, look, here's what we're seeing, and here's the truth about it. I will say that there are other amazing advocates and nonprofits out in the community right now that can represent different voices, which is really, really important. So shout out to Christy Hodges at OCD Game Changers and Riley's Wish and Made of Millions and other organizations that really fill gaps and can speak to a more personal level. And so I think multiple voices coming from multiple places, positions, intentions, emotions really rounded out beautifully to be able to get the message home. But I know we heard a lot of feedback on, especially the Wall Street Journal article and our response to it, and why we responded that way and how we responded that way. So I just wanted to say that's, and Jeff can weigh in, or Liz can weigh in, or Susan can weigh in, but our approach is very thought out and very strategic. And it is because we want it to be as impactful as we can from a nonprofit. And frankly, you know, we want media outlets to publish our blogs and publish our articles and continue to help us educate the public. So we're very careful to not just go after these people when they make a mistake, and instead address proactively in healthy ways. Jeff, do you want to, or Liz, do you guys want to weigh in on sort of how we've been addressing stigma and our approach to it?
Yeah, I mean, I think over the years, our approach has been personal. You know, I think that the way we've addressed stigma is we've taken opportunities to educate as a way for us to shift the conversation about stigma in a way that will no longer hopefully stigmatize, and instead will allow us to understand and allow people to relate. I think, as Ethan pointed out early on, you know, oftentimes we get defensive, myself included. I get really angry at some of these things that I read. I get really upset because OCD is personal. OCD is devastating. OCD is debilitating to many of us, and to many families. And so I think the way the foundation's approach has always been this slow, steady, methodical opportunity when we see these things happen, versus it being like a reaction. And I think that's been something I've learned a ton from, is how can we take what we're seeing and use it as an opportunity to educate? Because that's really how we're going to get the messaging to shift. And that's really how we're going to get people to change the way they view OCD and mental illness overall. And I think, Ethan, you didn't give yourself the credit you deserve for the OCD is not an adjective video, because that was you. You're the mastermind and the brains behind it. And we've all seen the comments, the likes, the feedback. And it's truly incredible to see what you were able to put together, and the way a short little clip can probably change the way people view OCD forever. And so again, this is where I would say repost it, share it, use it as an opportunity for us to talk and educate, because that's what changing stigma and the conversation is all about.
Well, thank you, Liz. And Fran, go ahead, Jeff.
Well, so I just want to build on that, because we just had a conversation, Ethan, that's relevant in terms of what people can do. So the next time, where we actually have a backlog of people that we want to respond to, we're working to put together a page on our website that is 15 different ways that you can respond to OCD being misused, whether it's to share the longer video, the shorter video, a meme. You can pick and choose. Now, when I was in college, I was part of the Human Rights Campaign, and all you did in the Human Rights Campaign is they identified a political prisoner in some part of the world, and everyone around the world just wrote a letter saying, can you please let this person go, whatever it was. And the stories that they would tell, they would say, like, when they got 50,000 letters, they started to pay attention. And so we're thinking, when we see a Chloe OCD do her Chloe OCD again, we're going to reach out to all of our OCD advocates. So if you haven't signed up as an OCD advocate, go to the website, sign up. We're going to give you a shout out. We're going to say, look, here's someone who's misusing OCD. Can you go and pick one of these memes or videos and post it on their channel, their social media, to say that here's an opportunity for you to rethink what you just said. And the way that Liz said, through research, we know the best way to reduce stigma and to get people to stop misusing terms like OCD is through education and personal stories. So if we have 2,000 people respond to someone using OCD inappropriately, they will think twice, right? And when we respond and we have a half dozen of us saying, that's not nice to do, and then you have a half dozen people saying, get over it, like, let's drown out the trolls, right? So sign up as an OCD advocate and help us start targeting these, again, in the way that Ethan's saying, 9 times out of 10, this is just ignorance and just not understanding. So,
thank you, Jeff. Susan, anything to add?
Yeah, I think personal stories are the key. For us, because my daughter was willing to tell her story, we're able to educate people when they say something that's, I'm so OCD because blah, blah, blah. And we're able to say, actually, this is what it looks like. But more than that, just telling her story to folks, or telling my story as a parent of someone with severe OCD, there's never a time that I tell the story to more than 4 people that someone doesn't call me afterwards and say, I'm worried about my sister, I'm worried about myself, I'm worried about my husband, I'm worried about my daughter, I'm worried about my niece, I'm worried about the friend of a friend. Everyone knows someone with OCD. What they don't usually know is the behavior that they're seeing is OCD. So the more we can talk about what OCD really is and how it impacts people, we're not just raising awareness about the illness that's impacted all of us, we're also helping people that have it understand that they do have it. And so it's an incremental effort. Every single time you tell your story, if you're comfortable with it, you do not have to tell your story. There's lots of ways to advocate. But for those of you that are, every time you tell it, you will be helping another person. There's no one whose life is not impacted by OCD.
Absolutely. That's beautifully said, Susan. And that's true just in the comments, just in commenting. So thank you. I think that pretty much sums up our State of the Union as far as bullet pointed things we definitely wanted to address. We now want to turn to your questions. I see a bunch of great comments. I'm actually going to group a bunch of questions and get everyone's thoughts on it. So Fran, there's nothing specific to post, but a lot of people are talking about the cost of therapy and affordability and insurance, and asking, do we think that BBC, I don't know, do we think that teletherapy and telehealth may change the affordability of OCD treatment, specifically in receiving ERP? As you mentioned before, Jeff, I know NOCD is working tirelessly to create affordable, effective care under Patrick and Stephen. What are your thoughts as we venture sort of into this new frontier of cost-effective treatment on a teletherapy platform for OCD and related disorders?
And I'll take this first. When I first started doing advocacy work, it was in 2007. I went to the Texas State Senate and fought for mental health parity. I was young and had more energy, but I remember going and not really knowing what I was doing, being really excited to share my story and talk about why mental health parity needs to exist, why we need to treat the brain the same way we treat the rest of the body when it comes to healthcare. And we won. We won. It was amazing. It was passed. And guess what? Nothing happened. Here we are 13 years later, and mental health parity exists in Texas, but the opportunity for us to use it and receive care for it it's not really implemented. And so I'll say two things. And I end every webinar with my same comment: help and hope are always available. And I mean that, because sometimes it's a tough journey to get there, and we have to search and seek. And that's what organizations like mine at Peace of Mind does, is helps people navigate the system. But there's a lot of opportunity for us with OCD. Sometimes we just have to advocate for ourselves until the healthcare system can get caught up. But I will ask Chelsea to please go ahead and post the article by Fred Penzel that's on the International Foundation's website, and hopefully they'll post it also. But this is a wonderful article that walks you through the steps of how you can get insurance reimbursement for effective OCD treatment. And I think it's really critical we think about that. So often we'll call and say, do you take insurance? And somebody will say no, and we just hang up. If someone says no, they don't take insurance, that does not mean you can't use your insurance to get treatment from that individual. All of us in the OCD community can provide what we call a super bill. And you take that super bill and you file independently. And because OCD is specialty care, if you have out-of-network options, it's actually, not to say simple, but there's a high likelihood that you'll be able to get reimbursement or use insurance in some capacity. So do we have eons to go to where insurance is easily used and it's easily accessible for us to get mental health treatment appropriately? Of course. But here's what I'll say. Make sure that the care that you're getting is specialty care for OCD, besides just going to a provider who takes your insurance. Because the reality is that while that might save you some money, it's not going to save you time. And in the long run, you spent a lot of money and not had the progress and have to end up in that specialty care anyways. So find a way to be able to get the specialty care with the resources you have. And organizations like Peace of Mind, like IOCDF, help people navigate that and help them understand what their rights are and how they can get the treatment that exists for them. So is the system broken? Yes. Does the way we get mental health treatment need to change? Absolutely. But the access to care right now is completely different than it was 5 years, 10 years, 15 years ago. And I'm grateful and hopeful that that will continue to change. Jeff, I know you have more thoughts on it.
Yeah, I mean, so I think there's a couple interesting things that are going to happen. One, COVID is going to change access to teletherapy. That just seems like that's a no-brainer for a couple of reasons. One is that everyone's doing it right now. Two is that therapists who had never even thought of it before, again, are thinking, I could save money on my own overhead. I don't have to go into the office. I could have my private practice suite for 2 days a week or 3 days a week rather than 5 days a week. So their overhead might go down, and they may pass that along to their patients. And I agree with Liz also that absolutely go to your insurance company and say, I want out of network. A lot of folks I've seen have been able to do that, where you just end up submitting your invoice to the insurance and the insurance reimburses you. The other thing I think that's going to happen, won't it be interesting how much increase we're going to see in mental health issues during and following COVID. And so when we have the decision makers in states and federally start to have an increase in mental health issues in their families, I wonder if they're going to be more willing and interested in starting to lobby against some of these insurance companies for increased insurance benefits. I do think we are going to see a spike. Not an OCD. If you're predisposed and COVID happened, then you might have gotten pushed into OCD. But there's going to be a lot of issues around depression, around anxiety, around social anxiety as we all venture back out into the world. So I think, again, this might bode well for us.
Yeah,
absolutely. I'm gonna, again, Fran, nothing to post. I'm gonna loop, combine a couple questions together. This one's to Jeff. And we're getting a lot of international questions, and a lot of the questions are like, how can I get international resources ranging from Canada to Belgium and Europe and India? And so that's a great question, because I know we have the resource directory. Does it encompass international? And if not, like how can people internationally access potential? And I know Peace of Mind has some stuff as well, so I can throw it out to Liz as well.
Yeah, so about a quarter of our website users are international. So we've been aware of that. When we built the resource directory, we built it with international resources in mind. And if people, a therapist or a clinic want to join that, they should contact us. There's for the first year for an international provider, there's a no fee because we're trying to build those parts of our resources. We're about to, this is Susan and Liz, you're going to have to vote on this, but we're going to be partnering with a university that's going to start translating all of our websites, all of our material into Spanish, and we'll be posting that. We do have global partners around the world. We kind of underutilize our relationship with them, usually just because we have our hands full. But we do have partners in China, in Japan, we're trying to develop one in India where there are their own independent OCD foundations, and we do a lot of shared translations. So a lot of times we get outreach from other countries and they ask to use our materials and we say yes. And we say anything you translate, post on your website, but also send back to us so we can post on our website. I think, again, one of the things that's going to happen when we all go virtual is we were all starting to move towards doing trainings internationally virtually. And I think that's just going to double and triple. I've done trainings in China and Japan and Ecuador and excuse me. And so I think, again, when we start thinking virtually, I think we can increase resources online in a way that we don't need to do in person, don't have to do in person. So I hope that answers the question.
Go ahead, Susan, yes.
Yeah, I think there's also, we're going to need to train more providers to be able to do ERP therapy that do take Medicare, that do take different insurance providers. I think that's a really critical part. And so obviously we do training conferences around the nation, but one of the big questions that we always have is how do we make that more accessible for different types of providers? And so it's really not just a short-term question. It's also a longer-term question. It's kids or young people who may be thinking about a career right now. We'd strongly encourage you, if you have a passion for this, to move into doing OCD care and taking insurance and working with organizations that do that. If you have a passion for it, now is the time to start thinking about that schooling and how to move forward. If you are 8 years old and watching this, I would encourage you to start thinking about what your future career might be. And then if you have a passion for training therapists, then you can reach out to us and talk to us a little bit about how we do our fundraising for our BTTIs and how we may be moving those to a virtual community so that we can train more and more people.
I couldn't agree more. And I'll just say, that's exactly why Peace of Mind sponsored the BTTI in Houston, is because we wanted individuals in the public sector. So what I can tell you is that if you live in Houston, I know providers, no matter what your insurance carrier is, no matter if you don't have insurance, that you can get effective evidence-based care in my city, no matter what. And that has been a mission that the foundation has taken on. And I would encourage OCD, IOCDF's amazing affiliates to take on that mission. Right? Take on the mission of, in your cities, in your towns, in your states, start to train providers that work in the public sector. And I will tell you, I personally have done trainings in the public sector, and it is amazing. And it's incredible because if they can then rely on you for consulting, that you can feel comfortable someone has a basis, right? They might not be a full OCD specialist, or they might not have 10 years in OCD background, but if they know the basics and they can appropriately help you, right? That's better than nothing. And so there are resources. They do exist. Sometimes they're hard to find. Visit us at peaceofmind.com and we'll be happy to navigate that as well. I will tell you, we also did a sponsorship with Monica Williams through Peace of Mind, where we paid for her to train, I think, 4 or 6 clinicians in Pakistan on OCD treatment. And so it exists and there are resources, but sometimes we have to be creative. But I think that's a great takeaway for us at IOCDF, is to kind of think about, maybe we have a special section or page that focuses on the public sector and international and kind of, treatment that is maybe not so easily found on our provider search.
Thank you, Liz. Want to give a shout out to Cassie. She asks, how can people who can't afford to donate support to Sorry, reading would be interesting. How can people who can't afford to donate support the IOCDF? Any thoughts on advocacy or volunteering opportunities for members of the community? Cassie runs a very vibrant Instagram account. So, and she's awesome on social media. So thank you for the work that you do. And honestly, that's one of the ways to do it, is using social media in your platform, even if it's not the IOCDF brand, to create awareness. And that's an amazing way to advocate and support. As always, with the ambassador program and the OCD Advocate program, we're always trying to create opportunities and ways to contribute and advocate for the IOCDF. I will be the first to tell you, for better or worse, that programs that we may have had in the hopper kind of got put on hold while we kind of transitioned to virtual and found ways to support the community short term in terms of OCD, related disorder flare-ups, and COVID. So I think that's a great question, Cassie, and I'm going to mark it just as something to continue as we kind of get used to whatever this normal is, to be able to start continuing to push those opportunities out. But it was worth, it's a great question. As to how, I think social media, I think you can email me directly and we can come up with ways to engage. If you want to be part of videos. Even I'm thinking now, if even like, and this isn't IOCD specific, but Morgan's on here with Not Alone notes. You can even contact a lot of our strategic partners. And if you want to help them with writing letters, I think there's a lot of really creative ways that we as a community can help one another. Morgan wrote, I've never seen Ethan in a blazer before. Neither has anyone else. You are not alone. So the next question, and I've seen a few comments about this. I'll throw this out to Susan. So a lot of people are talking about IOCDF merch and being able to support the IOCDF through merchandising. Somebody wrote, actually, there was where was it? We can, what's that, Liz?
Like a contest and submitting. I saw that somewhere.
Well, somebody talked about, like, can we set up a store, an IOCDF store where people can go and buy merch to support? Okay, we could talk about that. The follow-up to that is also Debbie Rittner wrote, if you set up a virtual fundraiser, then I could definitely raise money. It's much easier for me to raise money if you have an official event.
Agreed.
Debbie, I agree with you. Debbie, I agree with you. Jeff, I agree with Debbie.
We might have a component for the Million Moves.
That'd be great.
The virtual event. Yeah. If people wanted to fundraise for that, I think we'll have a component for that.
I'm willing to dance publicly if we're doing a fundraiser. So
no one wants me to dance publicly, so they'd rather me.
That's why we're definitely going to have you dancing.
$5 if she dances.
Yeah, exactly. Well, see, I've already raised $5.
You offered to dance. You're cheap.
The link for the store is posted here. Second thing I just want to say, and I know we're coming to, I think we're wrapping up soon, is advocating is not what Ethan and I do. We advocate, there's no doubt, but that's not the only way advocacy looks. And I think for many of us, starting on a higher public platform seems scary. And I actually believe you should slowly work up to it. I don't think you should start overnight there. And so I will say what Susan was mentioning earlier of talking about the story in a small environment with 4 people, sharing a link with one person who's a friend who you think might be suffering. That's advocacy, right? You calling clinicians and calling until you find one who says they do ERP, you're advocating for yourself, for your treatment. And so remember, advocacy is not black and white. And for all of us, if we are connected with the OCD community, if we're providing education, if we're helping getting people connected, if we're working to get people connected with appropriate care, that's advocacy. And that's the best kind of advocacy that will make a difference in someone's life forever.
I agree. And I will
Our very first fundraiser that we ever did in our family was actually a lemonade stand to train a therapist we were using who did not know how to do ERP, and we wanted to send her to the BTTI. So we raised funds for her. She took insurance and just didn't have the opportunity to go. So there are small things that you can do all around the community that are really helpful. Sorry to interrupt, Ethan.
No problem. I was just going to read Thomas, who is an avid viewer of all our town halls. And I look forward to meeting you, Thomas, one day. He wrote, it takes time and effort to advocate. We're the effort, be patient with the time, which is a great thing to say. Opening myself up for questions seemed to really help. Most people mean well and will listen if I let them ask me things without fear of me snapping at them. So again, compassionate advocating is a really great way to go. This is a great question. Before we do, we're here. So I'm sorry, Jeff. He likes my tangenting, and I have to focus. It's very hard to focus. So I'm just going to take a moment actually and tell Liz, as much as the kind things Liz says about me. You know, I wouldn't even have footsteps to walk in without Liz's footsteps that she created years before I even knew what OCD advocacy was. And so, you know, just a gigantic, massive virtual hug and shout out to who has become one of my closest friends and partners in advocate crime, Liz, for all of her tireless work when she was 17 and thrust into a spotlight that she may or may not have been wanted to, and took on the challenge at some of her sickest times to be able to give light and visibility to OCD and show people not only what OCD really looked like, but also the courage to stand up for it and then continue to make that her profession. She advocates tirelessly. She does it as her job tirelessly. Whenever I'm talking to her, it's something OCD related or specific. She is definitely one of my heroes, and I'm honored to always stand next to her, beside her. She's a little taller, whatever, but stand next to her and beside her in this journey. She's taught me so much about advocacy and about our community, and I continued for many years. So thank you for your sweet and comments about me, Liz, but you know, I wouldn't be half the advocate if it weren't for you. So
thank you.
Nancy Foster has a really great question. I'll throw this out to whoever knows, because I don't. 3:01 p.m. Fram, why won't clinicians take Medicare?
It's about reimbursement, and it's about reimbursement rates and getting credentialed, which makes it really difficult. But there are absolutely clinicians that where they work accepts Medicare that are appropriate OCD providers. So if that makes sense. So not all OCD clinicians take Medicare, not all OCD clinicians take insurance, but there are clinicians who accept Medicare that are OCD providers and specialists. I know in Houston, I could name off the ones. And then of course in Boston, there's options as well. And I believe McLean does take Medicare in Boston. So there are specialty clinics. There are options for Medicare, for you to use Medicare to get treatment. It just, again, this is where you have to navigate it a little bit more. Rely on us. Email us at info@peaceofmind.com. Rely on IOCDF and different places to kind of help navigate that and point you in the right direction.
Absolutely. Thank you, Liz. Carol Retner, this goes back to advocacy and what Liz was saying. She just commented, I don't shout that I have OCD from the mountaintops yet, but if I'm talking to a friend about it at work and someone comes near, we don't stop talking about it either. I was surprised how many people are interested, and even if they aren't comfortable asking me, many will go back and ask my friends. I can tell you from personal experience, and I'm sure Liz can tell you the same, and I always find planes the most interesting time to talk about OCD, because inevitably, if you're sitting next to somebody that wants to talk, which is me every time, but you know, somebody will be like, hey, where are you going? Where are you coming from? And inevitably I'm going to a speaking event or from a speaking event, and I'll tell them, oh, I advocate for mental health. And they go, oh, really? Well, what does that mean? I'm like, well, I talk about OCD. And we end up going into this huge conversation about OCD. And 99.9% of the time, at some point in that conversation, they pause and either go, well, you know, I actually struggle with blah, 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 or my daughter, my sister, my best friend, and there's an immediate connection. And I've never had a bad conversation on a plane or frankly anywhere else. At least on one hand, I can count the negative encounters that I've had over the last 10 years. Most of them have been amazing. So also, if you're on the chat or on the stream, everything that we've talked about, Fran behind the scenes has posted links to any and all. You can click on links and find links to how to get involved as an OCD advocate or ambassador. You can find links to the videos that we were talking about of OCD not being an adjective. So please take your time, go through the chats or the comment thread. Even afterwards, everybody's left really, really wonderful comments, and you can also find resources as well as to Peace of Mind and all of their resources as well. I'm just quickly going through. Oh, it updates.
Ethan, do you want me to? I can talk about the T-shirt. Go back.
Yeah. Oh, yeah. The merch, please.
So the printer that we use, the T-shirt printer, is closed due to COVID. I was just asking Fran, have we looked into any other T-shirt printers? So we'll kind of figure that out. We did do a two-part contest for a T-shirt. So there was a slogan contest, and this was prior to COVID, but embrace uncertainty is the winner of the slogan. And there's part two, a design part, to do a design around embrace uncertainty. And so that's available. Fran posted that for you. Get Amy Mary Askin to submit a design. People are nominating her.
Absolutely. Also, as long as we are here, I know there's a lot of people, a lot of OCD are people on here. So quickly, just to venture away from the logistics of the IOCDF, just to throw out some skills and tools that may not have, for people that may not have been on previous town halls. Do you have strategies to cope during this pandemic? Liz, do you want to quickly talk about successfully dealing with this pandemic during this time with OCD and related disorders?
I think my words of wisdom are give yourself grace and stay involved in treatment. The biggest thing I've said from the beginning is that the pandemic and us being at home and life slowing down should not be a reason you choose to slow down treatment or pause treatment. And I think for a lot of us, we made the choice to put treatment on hold because the rest of life seemed to be on hold. But what we know is that OCD doesn't go on hold. So continue to engage in treatment. I know I go to therapy every week. I 7 a.m. on Wednesday mornings, and that's my teletherapy session. So, go when you need to go. There's no shame in that. And I think it's critical you recognize when and how and if the pandemic is increasing your symptoms and you get appropriate treatment now. Don't wait. A lot of times we're hearing people say, well, I'll wait till you're in person. I'll wait for why, right? We know treatment can be effective. We know we can do it through tele. We know we can do it in a triggering environment. And the longer we wait without appropriate treatment, the worse our symptoms and disability from the illness gets. So get treatment, be your own advocate and plan for how you're going to take care of yourself. I think with OCD, we often have black and white thinking. If we have a bad day, we think we've relapsed, and sometimes we label it as that. And I would caution you to give yourself grace and recognize that people without OCD are struggling more than they ever have in their life, right? They are confused. They're frustrated. They're dealing with the situation and trying to navigate the uncertainty. And so, of course, for those of us with OCD, we might see a spike as well. Navigate it the way you would have navigated a spike without COVID. So that is with appropriate care and engagement in ERP.
And using the CDC and WHO guidelines as a baseline as far as health goes and managing what's safe and what isn't.
Always, I think that we need to use the guidelines that we're given from our government, but we need to make sure those guidelines don't become muddled by OCD and that they don't become confused and changed into OCD guidelines, right? So a 20-second hand wash is a 20-second hand wash. It's not a 2-minute hand wash. I'm not done yet, and this is what the CDC is telling me to do. And so again, it's taking the guidelines in a realistic way and not letting OCD take control.
And you are also by far not alone. I think all of us are facing our own weirdness as we move forward. I know I went to CVS day before yesterday. I hadn't ventured out in about a week and a half. And I was like, the fear of what was out there was starting to grow a little bit. And I was like, I better go out before the fear gets too big. Because as we know, the more we avoid fear, the bigger the fear gets. I live with my elderly parents. They'll really appreciate me calling them elderly when I watch this back. I'm so happy about that comment. But anyway, I'm saying I'm quarantining. I live with them temporarily during that. Anyway, yeah, I'm here. So, but anyway, so wow, I just went out with information I didn't want to give out, but whatever, it's temporary. So, so I put on gloves and a mask, and I was shopping and everything, and my phone rang. It was Lisa Coyne, actually. Hi, Lisa. Thank you for watching. And my phone rang, and I literally didn't know what to do because my phone was ringing in my pocket. I had my gloves, which had touched everything. I had my mask on, and I was like, do I get my phone? Do I not get my phone? If I get my phone, then the gloves are going to touch the phone. And I started going through that whole process of like, well, my phone is safe in its pocket right now. It's been in a vacuum sealed short pocket, and I'm not breaking it out into the environment of the unknown. So the bottom line is you're definitely not alone, Rebecca. I think we're all navigating these weird times where sort of what was normal before doesn't feel normal now. And so, there's a lot of trial and error, but Liz said it. Now is not a time to give OCD a break, to lighten up. Kim Quinlan says it beautifully. I agree with her. Right now, the exposure is life. That's the E. So we need to really engage in the response prevention. I'll throw out one question real quick. This is from our friend with the diversity question at the beginning. His or her name is SC. And she, at 3:08 p.m., Fran, if you want to put this up, she said, great idea about training. Is there a mentoring group therapists can sign up for?
So a couple things. One, we do online consultations. They're paid. It is very, very skilled faculty. We've been doing these actually for the last couple of years. It's one of the very successful virtual events that we've had. It's one faculty and 3 attendees. They do a Zoom meeting. They meet for 90 minutes. They meet for 6 to 8 weeks, although we're going to use an open format. So that's a paid option. A free option is a Facebook group put together by Michelle Massey and Allison Stimson, and I think one other person I'm forgetting. Email me.
Jennifer Ray, maybe?
No.
Okay, just kidding.
Anyway, so it's a Facebook group, and it's all peer consultation. People are on it every day. It's super, super helpful. I'm on it, and different people are announcing different resources, different trainings, and giving consultation. So great group. If you email me, actually just do info@iocdf.org, and Betsy will forward it to me, because otherwise I have to spell my last name, which is stupidity. Oh, although it's on the screen, Szymanski@iocdf.org.
What does it mean? Is it Polish?
It's big Polish.
Does it mean
Polish.
anything?
It means son of Shim. Oh, son of Simon.
Was your dad named Simon?
No.
So you're a lie.
Yeah.
Okay, cool. Just curious. I mean, NBC, inquiring minds want to know. So now we know.
So Ethan, I do want to make sure, because we're running out of time. Yep. I want to cycle back to the conference a little bit. I don't know if you want to do that right now or
go ahead.
Oh, okay. So there's some people I saw that said they didn't see or they weren't on when we talked about the conference. So just to kind of review, we are still in a contract with the Hyatt in Seattle. They have offered to modify the contract, and so we're working with them to scale down the conference into actually an event of unknown right now program and unknown size. That we'll be figuring that out. We have moved the accepted program from 2020 to 2021. So if you're accepted for this year to speak, you will be speaking in New York City in 2021. And we've moved to developing. We are going to try and take the 2020 program and push it into a virtual format. And then we had multiple nosebleeds and just decided to start all over again. So we will be basically pulling together a virtual conference. We're in the midst of doing that. We're thinking of starting around 11 a.m. in the morning on the East Coast. That means the West Coast doesn't have to get up till 8. I think we're going to do a 45-minute pre-recorded workshop, and then that group can be asking questions. So even though it's pre-recorded, the presenter will be live, and you can chat them questions, and they will chat answers back. And then for 30 minutes, you're going to get pushed into a Zoom, and you can do a live Q&A with that faculty. And so it'll be an hour and 15 minutes, and then we're going to do a 15-minute yoga break, stretch break, go bathroom break. Then we're going to repeat that. We'll have 4 blocks. We'll probably do that Friday, Saturday, Sunday. And then, as Ethan mentioned, we're going to do as many of the tracks as we can at the same time. But again, some of these things just aren't going to translate in a way that we, like the kids are, we're still trying to wrap our head around that. If anyone has any ideas, let us know. But even like support groups, we are thinking of either having a support group track, or we are thinking of maybe doing a Thursday night, maybe an icebreaker, and then a couple rounds of support groups and make that free. We will do a charge for the virtual conference this year, obviously on a much reduced rate. I think we're looking at like somewhere between 30 to 50% of a typical registration rate. Still messing around with all those things, but I wanted to just give you guys an update about how we're kind of beginning to construct our thinking around the conference.
Great. Thank you, Jeff. A few more points as we wrap up, but I want to give Liz and Susan some final thoughts. So Liz?
Just thank you. Thank y'all for joining. I know for many of you to attend, it's an exposure. For many of you, you're attending and you're struggling. And I think for us to be able to offer support in any way is why we do the work that we do. And again, my clip I always leave with is that are always available. It doesn't matter who you are, where you live, and what your resources are. There's options available for you, and I want people to always keep that in mind. Please email us directly or email me at Elizabeth or info@peaceofmind.com, and we'll be happy to help navigate that for you. Please continue to check out IOCDF.org as we come up with more details and have a more clear and concise plan for the conference this year. Please make sure that you check it out and sign up. I know that we will do everything we can to make it just as meaningful, but it will be in a new, unique way and platform, and that's okay.
And Susan? Thank you, Liz.
Yeah, I echo that. Thank you guys so much for coming and listening today, and for all the great comments that we've had here. For those of you that are struggling, I encourage you to check out IOCDF.org. We have a COVID-specific resource page. I saw a few people were asking about additional coping strategies, where there's lots of great links there about that. And for those of you out there that may be thinking about whether or not you have OCD, please reach out to us. We're happy to talk to you. All of us are very happy to talk about it. We have lots of great advocates out there that would be willing to connect. And we have so many great resources online for you to learn about what OCD is. I saw some comments from some folks in the UK about being treated like they had a very severe illness. And I think I always like to say to folks that OCD can be a very severe illness, but there is terrific treatment for it. And so the way we work here is with a lot of hope, because there is a lot of help out there. So we encourage you to reach out.
Thank you. Thank you. If you're still with us, I'm glad you stuck around, because thank you, first of all, to Jeff, Liz, and Susan for joining us and giving us an update into all things IOCDF. I know a lot of people had tons of questions about the conference and what was moving forward, so I hope we answered your questions. I know people are continuing to ask questions, some pretty specific ones. I will give you some email addresses where you can feel free to email us, and we'd be happy to answer those questions. So 2 quick announcements. The first big one is, if you're familiar with the documentary Uncovering OCD, The Truth About Obsessive Compulsive Disorder, which is a documentary that I, myself, and my producing partners, Andy Hurst and Zaki Rubenstein, made, along with Biohaven Pharmaceuticals. We will be releasing it today publicly. As a matter of fact, Fran will post a link to the documentary. I know I get daily emails about this documentary and where people can see it. We want to go ahead and release it now. We know times are tough, education. And this is also not only, I got some beautiful emails recently. One from a therapist that said that she had a client that had so much difficulty getting her parents to understand what she was going through, and showed this documentary to her parents, and they finally understood for the first time, and she came in just crying, experiencing, this is not me brag, I'm just saying there's some really amazing advocates in this documentary. It's all personal stories. It's 42 minutes, but it's also a great reference if somebody's like, I don't know what OCD is. It covers just the basics from a personal standpoint, a lot of different viewpoints, and so we actually have some great diversity as well. So Fran will post a link. This is available to you. It will not be disappearing. You can share it. You can keep it. You can save it. Bye, Liz, and please feel free to do so. Just some quick housekeeping. Finally, let me scroll down to it. So yes, thank you, Jeff, Susan, and Liz. I thank Liz already. So this week we are again action-packed. Town halls. Monday at 1 p.m. we have Managing Hoarding Disorder in the Time of COVID, Volume 2. That will be on all Facebook and YouTube channels. Tuesday at 7 p.m. we have a regular acoustic unplugged version of Just Ethan with Just Ethan. Wednesday at 7 p.m. we'll be having Coping with Intrusive Thoughts, Volume 3. You will definitely not want to miss that. That has been a really, really popular. We're glad to talk about really stigmatized conversations. Hey, Liz, welcome back. Welcome.
Sorry. Every time I go to put a comment, it logs me off.
Yeah, well, we don't like your comments. We'll just have to live with that uncertainty. So Wednesday, yes, Intrusive Thoughts. And then next Saturday, we'll be doing a special town hall. We're excited about this one. Susan will be joining us again. It's around parents whose children have OCD. So Susan, along with Chris Bear, the mastermind behind Unstuck, along with his wife, Allie, as well as Denise Egan-Stack, clinical genius and expertise, will be joining us for a conversation for parents. So we really look forward to that. As always, I'd like to thank the IOCDF, and I'd like to thank our digital guru and voodoo master, Fran, behind the scenes for all his work and answering questions. Again, thank you for tuning in. Please feel free to go to the comment thread, click on the links, look at everyone's comments and suggestions. Last but not least, you can always email myself at justethan@iocdf.org. I will always get back to you. I am caught up on emails still, so I'm super excited about that. So if you email now, you'll get an answer in a couple of days. And as always, you can email the IOCDF at info@iocdf.org. Thanks again to Jeff, Elizabeth, and Susan. Stay safe, still stay vigilant, feel the feels, be gentle, give yourself grace. Don't let OCD don't let OCD off the hook, and we'll see you next time. Thanks.
Thank you.
Bye, guys.